Yeah, and in addition to cancer and heart disease, there's two other diseases that the same indicators will give you risk factors for, which is diabetes. 1 in 4 people have it. And the
Wow.
upcoming epidemic, which is losing your brain and your mind, which is Alzheimer's. And the projections are 1 in 3 people will have that in the next few decades. So,
And all four of those major disease categories are related to excessive inflammation. And I wrote a little book on inflammation, which basically showed that the major factor that's causing an excessive inflammation in modern times is the diet. The modern diet is 20 times more inflammatory than the hunter-gatherer type diet.
so that's clearly a key indication. And, another element that I think has not gotten a lot of press, but I'm really recently exploring and really haven't talked about it too much on the site is something called earthing, where you're grounding yourself to the earth, either ideally when you're sleeping or certainly in your work environment, because then the earth is able to pass these free electrons and get rid of that inflammation. And Dr. Steven Sinatra, who's probably the leading natural cardiologist in the country, has done a lot of work in this area and has actually shown it massively improves platelet aggregation and decreases the blood clotting, limits the blood clotting, or optimizes the blood clotting ability of the blood, which is why most people have strokes and heart attacks, is because they get a blood clot, which is related to the inflammation. So a lot of basic things, and I think I'm beginning. I know your experiences with earthing, but personally, I've been using it for a while, and I've known about it for about 5-6 years, but I recently became convinced that it's valid, and my concerns about sort of using it as an antenna for gathering negative EMFs were not valid, and we're going to be recommending it in the near future.
Yeah, I think it's a good idea. The other thing that's come up in the whole IV vitamin C arena is that one of the causes for cancer is decreased oxygen utilization. And it's interesting to me that that a lot of the therapies that are used for cancer actually are using oxidants, intracellular oxidants, because vitamin C at high dosages creates more of the hydroxyl radical. Dr. Frank Schellenberger is using ozone therapy as a treatment for cancer patients. He has developed a way of measuring ATP utilization, and he says every cancer patient he's checked has very low ATP levels. And so when you use an oxidant, you improve your transformation of NADH to NAD. And NAD is absolutely necessary at the cellular level in order to make ATP. And if you have adequate amounts of ATP, then your cells can generate the antioxidant enzymes that you need to control the excessive oxidation that sets up the inflammatory response and the whole cascade of events that lead towards cancer. So things like exercise or anything, or exercise with oxygen therapy, anything that can improve your utilization of oxygen may be actually an anti-cancer approach.
Excellent. So one of the other areas that people believe there may be an indication for and are actually using it, and I wonder if you can comment on this, is the use of IV vitamin C or oral vitamin C to chelate out heavy metals or for detoxing. And what is your experience with that?
Yeah, well, this is pretty well covered in Dr. Levy's book, Curing the Incurable. He covers about 10 different major toxins that vitamin C will help to neutralize. And in my talk on the IV vitamin C protocol for cancer patients, remember that I mentioned that cancer is due to sustained injury. Well, if you've got to remove the cause, if you hope to get over the cancer. And so very often heavy metal toxicity is a major cause of cancer. It reduces ATP formation. It interferes with enzyme functioning within cells. So if you can remove, the other big thing we're finding out is that heavy metals reduce your body's ability to spontaneously generate adult stem cells. So if you want to promote healing within the body, you have to do everything you can to detoxify. And so IV vitamin C is a mild chelator, as well as it helps your detoxification systems in the body and restores glutathione functioning and things like that.
Excellent. I recently met a surgical oncologist who works out of Washington, D.C., who was using infrared saunas in
Mhm.
conjunction with, interestingly, a high dose of niacin to
Yeah,
serve as a lipolysis, because most of the toxins are stored in the fat,
right. No,
about
I agree with
about
that.
100 to 1.
Absolutely.
And he was doing pre and post fat biopsies to monitor the effectiveness. And he was seeing extraordinary results. He actually had an $8 million grant from the Department of Defense to treat uh, Gulf War veterans and 9/11 victims, and was seeing really impressive results. But so I think that would be another component. And so he used the high dose niacin up to 5 grams, working up slowly
Yeah,
with the sauna and actually exercising before to stimulate the lymphatics and get it out. So we're seeing
right.
pretty
Yep.
impressive results. So
So I agree. Yeah, if you're going to treat cancer, you can't rely upon one modality. Even though we do kind of focus on IV vitamin C at our clinic, we basically are measuring nutrient levels. We're having people re-examine what they're eating. We're encouraging detoxification strategies, regular exercise, adequate sleep, improving interpersonal relationships. All of this can have a bearing on your outcome in cancer.
great. And I guess, a real common one that traditionally, of course, people have used vitamin C is for the common cold. I've been promoting high dose vitamin D if you haven't been using it before as a one-time dose, but I just think a combination will be good. So, I mean, what are your most effective strategies for incorporating vitamin C? From what you mentioned earlier, it sounds like an every hour use of the vitamin C supplement would be useful if you can integrate that into your lifestyle. But rather than taking one dose once a day or even twice a day, you're going to get better results if you have a more lower dose more frequently.
Yeah, you're going to get higher sustained blood levels. And if you're starting to come down with a cold, then I would recommend anywhere from 1 to 4 grams every hour until you get loose stools. And very often you can head off a cold that way. And then I also use 50,000 units of vitamin D3 one or once or twice a day for a couple days if you want to try to stop a cold in its tracks.
Yeah, the earlier you start, the better, I'm sure. Do you find that those doses that it makes any difference if you're using a vitamin C with bioflavonoids or a powder that you would put in, or if the type of powder like sodium ascorbate versus some of the other mineral ascorbates may make a difference?
Dr. Gary Gordon has come up with a what he calls a tightly bound sodium ascorbate powder that incorporates some D-ribose and MSM. And I've been using a lot of that lately, and I've found that people can take a lot more of it than they can regular buffered C or ascorbic acid. But it's more expensive.
Hmm.
I think ascorbic acid is fine if you put it, if you have to put it in a little bit of water with a little bit of juice in it, and that'll cut the taste. And as long as it doesn't upset your stomach, if you do a small amount frequently, you should be fine.
Would the juice like a lemon from a lemon or a lime, which you have much less
Yeah,
fructose and be
right.
so that,
That'd be the
that
best way to do it. Yeah,
would
yeah.
buffer it essentially?
Yeah, it will to a certain extent. Yeah, it will to a certain extent. Yeah.
Okay. Yeah, I like lemon and limes. In fact, it's sort of our trick for using vegetable juice, which is another powerful intervention, just juicing vegetables, because we all need, 5, 6, 7 servings of vegetables a day. And how many of us are doing that? So if you integrate a vegetable juice into your program, you can do that. But the lime makes a huge, or a lemon makes a huge difference in making it palatable.
Right. Right. I think that's a great idea.
So,
Dr. Abram Hoffer, who was Dr. Reardon's good friend, actually did a thing with about I don't know, it was up to 1,000 patients. This was years ago, where he had them go up to as high of an amount of vitamin C as they could take, niacin, B complex, selenium, vitamin E, and vitamin D. And this oral program he found dramatically improved survivability in cancer patients.
excellent.
So some of these oral synergisms, like I call it redox synergy, if you use these things together, you're going to get a lot better effects than if you use just one thing alone.
Yeah, so a lot of times, what I've noticed after 3 decades in health is that the more you know and really understand about the truth of the matter, it's pretty simple. It's back to the basics. It's not rocket science, And really, and that's very encouraging for those who are listening, because it really empowers us to understand that we can, as a consumer, as a patient who didn't go to medical school, really take control of our health, and to integrating these very simple and most of the time inexpensive and virtually in most cases without side effects
That's
treatments
right.
that can
That's
that
right.
can have radical improvements in your health, that you don't have to rely on these dangerous and expensive medications that can wipe you out prematurely. So
I've often told patients that your cells really don't care what diagnosis the doctor is giving the problem. They only want to make sure they have the key nutrients that they need to run the metabolism of that cells have, and then they want to make sure that the toxins that interfere, the anti-nutrients that interfere with their functioning, get those out. And if you do those two things, you can achieve a very high level of health.
well, I'm glad we're in agreement with that, because it seems to make a lot of sense. So I guess we're at the end of the interview, and if you just want to make any closing comments and emphasize any key points, and then we'll additionally ask for specific follow-up information or content information if someone wants to find what you're doing and more about you.
Okay, yeah, I just to let people know that intravenous vitamin C, in my mind, is the rediscovery of an innate healing ability that all organisms use when they're stressed, sick, infected, or injured. And you know, IV vitamin C has been used in burn patients. It's been used in chronic infection patients. It's been used for depression. There's just so many things that respond well to intravenous vitamin C. This is for people that have a serious illness. Now, if you're well and you want to stay well, you don't have to do IV vitamin C. You can, though I do have a friend of mine in Japan who every sibling, I think he's got like 8 siblings, and they all have cancer. He's doing a 25-gram IV vitamin C every week to prevent the cancer that everyone else in his family seems to be getting. So you can use it preventatively, though I think good lifestyle, good habits of health, good nutrition works just as well if you can stay well that way. But if you do get sick, it's a very powerful tool that I think is underutilized by most doctors.
Okay, great. And again, if you can highlight the resources that people could obtain more information or learn about you and what you're doing in your clinic.
Well, the Reardon Clinic has a very nice website, and then if you click under research, there's 2 pathways you can go down. One, it has all of our research articles that we've published, over 100 different articles that we've published. And then on the other side of it, it has the Reardon IVC protocol and some basic information and videos about the RECNAC research project that was undertaken in the 90s that is very helpful to people. And then the other resource is the healthhunteronline.org, and you click on videos, and there's one called How Vitamin C Fights Cancer. That's me talking about the mechanism of how it works. And then the other one is Dr. Glenn Highland, IVC, chemotherapy, radiation, are they compatible? Where he gives a very compelling lecture to a group of scientists about how not only are they compatible, but they are synergistic and improve quality of life.
Well, I thank you for those resources. I thank you for your time today and helping us better understand this really powerful resource that we can easily incorporate into our lifestyle and use more aggressively if serious illness does develop, to a very good benefit for anyone seeking to apply that. So thank you again, and best of luck with your work out there.
And thank you, Joe, for all the work you do to get this message out.